how many compartments in the leg? Or the thigh, I should say, not the leg.
Three.
Three, what are
The medial.
they? Posterior, inferior, and medial, all right? What's my anterior compartment going to do?
Extend.
Those are going to be the extensors, right? Extensors of the leg.
The leg.
Very good,
Yeah.
right? Not the thigh, they're going to extend the leg,
The leg.
right? What extends the thigh?
No, the glass drop.
Yeah, so like my gluteals and things, right?
Yeah.
So those are your standing up muscles, right? Standing up muscles, like your gluteals, right? That are going to laterally rotate and then extend, right, at the hip, right? So you have to make sure that you give me what it is you're talking about. What's the relative term, right? I'm extending what? I'm extending the leg or the thigh. That's why we call them two different things, right? So the one that's going to extend the leg is going to have to cross the thigh-leg joint, right? Whereas the one that extends at the hip is going to have to cross the hip joint, right? So what's going to be like my flexor of the hip? The iliopsoas is one of the primary ones, which is really two muscles. The what?
The psoas.
Psoas major, which is a posterior abdominal wall muscle, and
the iliacus.
The iliacus, which is on that inner smooth kind of region of the ilium. Right? It's called the iliacus fossa. Right? The psoas major picks up the iliacus as it runs right into the pelvis. Right, and then those two are going to go down and insert on what?
Femur.
The femur, right? Think about it. They have to insert on the femur. If they're going to work on the hip joint, they have to actually cross that hip joint. I can't insert up here somewhere because I'm not pulling anything. They're working across the hip joint, so they're going to insert on the femur. Right? So later on in the abdominal stuff, you guys are going to learn, as part of your physical exam and everything, is the psoas sign, right, for testing someone with right lower quadrant pain, right, thinking appendicitis. Right, you might do this. You might look for the psoas sign, and so what are you going to do? Think about where the appendix is, roughly, right? Right in this area. We know that the psoas major is running right through there. So what would you want to do to see if it aggravates the appendix? You contract that muscle, right? If I contract that muscle, it's probably going to push on an aggravated appendix and make it hurt, right? The patient's going to want to jump up and hit you, right? So, what position do you have the patient in? Okay. They're on their back with supine. Do what? Bend their leg at 90 degrees. Right? You do that, and they guard or they squirm, they yell, right? That's the psoas sign. You've actually contracted the psoas to where it actually rubs against and aggravates the appendix. Right?
How do you extend the hip?
How do you
If you flex the hip, you would be bringing it towards you. So you're extending your hip.
It's your donkey kicks.
Yeah, your glutes.
Yeah, this is it. This
So
is
donkey kicks.
Donkey kicks.
But don't do it on me.
Come on, tell me you haven't done it.
This is
You worked your glutes before, Tom, or you can
Remember,
do your.
we talked about hyper and hypo, just like we talked about in the med side. It doesn't always mean like
Go up and
it's
squeeze the
like
glutes. Yeah.
bad, right? So this is hip extension. Anything beyond the normal angle is hyperextension. So this is hyperextension of the hip. This is flexion of the hip, right? So in any event, to hyperflex, you do the same thing, same muscles. It's just going beyond the normal angle. Right? So hip flexors are going to be largely hip flexors. Shortening that angle
Is the
flexors,
psoas and the iliacus.
psoas, iliacus, as well as in order to flex the hip, right? There also has to be a little bit of medial rotation, right, to get that ball on the socket to kind of line up. And so some of your medial compartment muscles, like the obturator, right, some of those are going to actually be working to kind of medially rotate so that I can flex at the hip. Whereas, so those are hip flexors, when somebody, an athlete, you guys that are athletes, you talked about, and you know, pulled my hip flexor. Where did it hurt?
On the side. Where is it now?
You know?
I wasn't that good in
It's
that.
like right here, you know, it's like right here, it's like, man, that really hurts, right?
I wasn't that good
You
in
do
that.
stretch, you know, you can lean forward, you got a lunge stretch, and you can feel it stretching those hip flexors. So that's partly what? When am I stretching? Where does it look like it's probably stretching? Right? It's not gracilis, but that'd be this, right? That's stretching, you know, that's that lateral extension. So you're actually stretching your hip flexors, which are, right, like the iliacus, and things which are doing what? Why do you feel them down here? I thought they were like way up here and here, like hips. That's what they're doing. Yeah, they're going to go through, right, my
Operator
through
frame.
the obturator and insert on the medial femur. Right? And so you are actually stretching those muscles, but you're largely stretching insertion. Right? That point of insertion, you're stretching it out, you know, so that we get nice loose tendons and whatnot to keep us from overstretching or hyperextending, hyperflexing, etc. Right? All right, so if we look at this, then what do I got here? Let's say I was going to get that down. So anterior compartment of the thigh is what? What do we call this again? What are they doing?
Quadriceps.
What they're doing, they're going to
Extends the leg.
extend the leg at the
Knee.
Okay? Extending the leg at the knee. And so we call them the quadriceps, so that must mean there's
Four.
four muscles, right? So what are my four muscles of the quadriceps? What's that? What's that one?
With the rectus femoris.
Rectus femoris. Okay?
Vastus lateralis.
Vastus lateralis,
Vastus
vastus
medialis.
medialis, and then get rid of my rectus femoris, and I find
Vastus intermedialis.
vastus intermedialis. Okay? So medial and lateral, that's pretty easy. All you gotta do is just remember vastus. Right? So vastus medialis, vastus lateralis, vastus intermedius, which sits right below the rectus femoris. Right? So could we? So that's those. Right? Spin that back and see if I can. Okay, got that back. All right, so now we got this weird muscle that seems to be kind of going. Look at where it's coming from. Up here. What is that? What is this? Like right where that red dot is. What is that?
That's your
My ASIS, right? My anterior superior iliac spine.
Mm-hmm.
Right? Very important landmark because it is palpable, right? And it doesn't really matter the habitus of your patient. I mean, to a certain extent, you know, you get into that, you know, my 600-pound life, you know, you may not be able to palpate this, but for the most part, you know, regardless of habitus, it's usually a palpable landmark. So it's actually a good landmark to kind of know because there's several things that we use that for. Such as McBurney's point, things like that. But this is where the sartorius originates. It actually moves what? Across the hip joint. What is it working on the hip joint?
No.
No, right? And then it goes down here to the medial compartment and does what? Inserts on the medial tibial condyle, right? So it's going to insert down there on the medial aspect of the tibia. And so what joint is it using? What joint is it moving? It's predominantly working on or moving the knee joint, right? So we're going to do what with the knee? Think about its orientation. What is it going to do?
Adduction, internal rotation.
Right? A little bit of I think what we said.
AD.
So a little bit of adduction, right, and medial rotation, right, to a little bit, to a certain extent, right. And so, right, so that's going to be part of my medial compartment. How do I know that? Because what does the medial compartment do? Not just, right, sartorius, but also what? Adductor longus, right? The adductor magnus. You have to get the adductor magnus out of the way, or the longus out of the way to find the brevis. And then also the gracilis. Those are the muscles of my medial compartment, which do what? Adduct. It's the adductor group, right? Innervated by nope, not the femoral.
No.
Femoral is going to be the anterior compartment. Remember, each
Anterior.
compartment is going to have
Anterior
its own
compartment.
nerve.
Obturator?
The obturator, right? Those are innervated by the obturator nerve, right? Which is a
Who innervates the anterior
Femoral.
Motor.
What's the nerve roots? If you know, since you guys are obsessed with the nerve roots.
Is it
It's
L,
2,
Yeah.
2, 3.
L2-3.
2-3.
Obturator. The femoral does the anterior compartment, which is a
3, 4.
2 to
yeah,
4.
so that's going to be more what we think of when we think like femoral nerve. We think lumbar vertebrae. Lumbar spine. So yeah, we're looking at it really, I think it even has some 2 in it, but it's like L3, 4, right? For the most part, 5. So there's multiple branches. The femoral nerve actually has there's two branches to the femoral nerve. There's the anterior and posterior division, right? The anterior division is what's going to go out and actually form my femoral nerve, which is the anterior compartment. The posterior femoral nerve roots are going to go and form they're going to go down to the adductor compartment, so we're going to get like my obturator from there. Okay. The sciatic, if you look at this at the sciatic nerve, it does the same thing. There's an anterior and posterior nerve root complex, or nerve root complex, and one is going to go down and feed the anterior compartment of the leg, the other the posterior compartment of the leg, so we also would call them the peroneal and tibial nerves, even at the level like up here, like in the abdomen where those nerve roots are coming off, anterior and posterior division, you could also name them tibial and fibular, right, or peroneal because of where they're going, right? So those are my nerve roots here. So that's going to be my medial compartment abduction, right? And so what am I going to get? How do I get my adduction? Sorry, that's wrong. That's adductors. How am I going to get my abduction, my abduction? That's, what do you call it?
Gluteal.
Right, gluteals is part of it, right? So my gluteals, if you look at the gluteal
Medius.
muscles, right? Look at the orientation of the gluteus maximus.
Yeah.
Right? There is a superior inferior orientation, but there's also a medial lateral orientation, which means that those muscles are largely going to do what? Both laterally rotate and extend. Right? So we're going to get some lateral rotation and extension. In other words, your butt muscles, the ones that help you stand up, right? If there's lesion to the gluteal nerves, right? Then you would have a difficult time standing up, right? But you could eventually, depending on which gluteal nerves are upset, you could theoretically extend, but you would have to assist in lateral rotation before you extend. Right? So when you stand up, there actually is, you don't feel it, you don't notice it, right? But there's a little bit of lateral rotation and extension, right? And that's largely because of the gluteals. The gluteal muscles. So we got the gluteal muscles. All right, if we take the gluteus maximus away, right, then you're going to find what? Right. So, all right, my gluteus medius. Now, what is its orientation?
It's pelvis.
Right. It's almost
Superior,
all
inferior.
what? Yeah, superior inferior, right? So it's oriented this way, which means it's going to be really beneficial in, right? So if it's going down, let's imagine down this way, right? So if I shorten that, what is it going to do?
It's going to pull the leg. It's going to add.
Exactly. It's going to be more of an abductor, right? There is some extension, but it's also going to give you some of that abduction, right? And then, right, if I find that so dissect that, and if I find my gluteus minimus, right, then what is it going to do? It is orientation. It's kind of more of like oblique like this, right? So there is, right? So it's kind of running obliquely here. So it's going to pull what? Kind of up and out, right? So So they're lateral rotators and extensors. Here we've got what muscle is that? So it's one of the only like kind of deeper muscles of the leg that I want you to know, or of the gluteal region.
Piriformis?
The piriformis, right? And we're going to learn more about the piriformis later because we'll look at it in terms of the pelvis, but you can see that it's coming through, right? The back side of the pelvis. Here's sacrum, right? So here's sacrum, here's ilium, right? You can see that it's coming from inside the pelvic cavity, right? Running through kind of that gap, if you will, between the sacrum and the ischium. And it's going to insert over here laterally. So what is it going to do? You shorten that muscle, it's going to do what? This guy's leg is going to come up through the table at you, right? So it's going to be one of those lateral rotators, right? So, but you notice that it also is going to kind of, I've got a nice little nerve right there. What nerve is that? Right underneath the piriformis, right? So the piriformis actually is what's dividing my sciatic foramen, if you will, into like a inferior and superior foramen, right? And so superiorly, right, above the sciatic, I'm going to get things like my superior gluteal artery. There's my superior gluteal nerve, right, coming up here above the piriformis. Below the piriformis, I'm going to get my inferior gluteal arteries as well as my sciatic, which is what you're more familiar with. Okay, so just kind of understand where it is that that's coming out, right? Now I told you guys in lab yesterday, or I think I got most groups, if not all of you, that I'm not going to ask you to necessarily identify the superior and inferior gluteals, because we'll touch on those when we get into the pelvis, because they come off of the internal iliacs, right? So I had them on the sheet because we used to do them, here, but we'll wait till the pelvis. I do want you to know your gluteals and your piriformis. I also said that I'm not gonna harp on some of these other really small, deep muscles of the gluteal region, like my superior and inferior gemellars, right? And then the superior and inferior the gemellus muscles, right? And some of those I'm not as picky on those. Okay, so just so you know, I'm not as concerned with those. But piriformis and the larger lateral rotator extenders of the legs, the gluteals, would be good to know. Okay. Let's see here. You can see like the quadriceps femoris is another one of those. It's kind of a deep muscle. Its orientation is basically opposite that of the piriformis. So what is it going to do? It's going to be more of a medial rotator, right? Because you can see the orientation is different, right? Running a different course. So, all right. So, what's going to help me? So, we're asking about abduction, right? This lateral extension of the leg. So, if we have the leg fully extended and then do this, that abduction, then not only is it the gluteals, but also this tensor fasciae latae, but that's just fascia. So what is it that there's something that has to pull on that fascia. And that's the tensor fasciae latae muscle, right? That then pulls on the fascia that makes up my iliotibial tract, the IG band. Okay? The iliotibial tract. Another one of those things that's commonly injured in athletes, right? Depending on, especially, I would imagine, I don't know from first-hand experience, but I would imagine probably even like, dancers and cheerleaders and all that kind of stuff, where there's a lot of this like, outward, excited legs and things,
Bruce Lee kicks.
Spirit fingers, I guess that'd be spirit legs. All right. That's anterior and medial compartment. So the tensor fasciae latae, what is it considered? Is it an anterior or lateral compartment?
Lateral.
It's an anterior compartment. There is no lateral. So it's an anterior part of muscle, but you can see that it's pulling on this IT band right over there. That's kind of in that lateral aspect of the leg. All right. So My posterior compartment then is going to be made up of what? Right? So my hamstrings, right? And those hamstrings got what? How many muscles are hamstrings?
2.
No,
2, 3, 4. I don't know.
Okay.
Well, let's count.
Semi-
Let's see how high we can count, right?
Yeah, semitendinosus.
Okay. So what we're going to see, right? There's this muscle here, right? That you can see that's going to be, right? That's kind of on this lateral side, and kind of moving around, right? So kind of on that, mediolateral side, right? And it's a unipinnate muscle, so it's just got one head to it, one body to it, right? So that's my. All right, well, it's either my semitendinosus or semimembranosus, and I know that because the biceps is probably going to have how many heads?
2.
2. This only has 1, so probably not the biceps, right? So if I look at this then, right, so there's my semitendinosus, right? So I could say, okay, well, what about this one that's kind of underneath that sits a little bit more medial?
Membranosus.
Right? That is the one that's going to only also be unipinnate, which means that it is a single head to it, right? That's my semimembranosus. I remember them just because membranosus has an M for medial, right? So it's a little bit more medial. I know, yes, it is also deep, right? But when you look at an extended leg, you usually can kind of see the difference, right? That separation that's a little bit more medial, a little bit more lateral. In the text, I believe that in order to show the semimembranosus, they have the semitendinosus. All right, it kind of contracted or it's pulled back, and they do that so that you can see the semimembranosus. The problem is that they pull it back kind of medial. Right? So don't look at that image and think, oh, then that's the medial one, right? It's just because it's been retracted, so you can see the semimembranosus underneath it, right? And so if that's the semimembranosus, here's my semitendinosus, then this guy over here on the lateral side, right, must be my biceps femoris, which I don't know why it's purple.
So why is it purple?
Anyways, because it's calling it a tendon. But so there's my biceps femoris. It's kind of hard to see laced off that, but you can kind of see, right there. Here's one head, right, and here's the other head. The other head actually sits underneath, right, that short head. Okay. So those are the 2 heads of the biceps femoris. Okay. All right. So biceps femoris, semitendinosus, semimembranosus, those are the muscles of my posterior compartment of the leg, innervated by the sciatic nerve. Right. So it's the sciatic nerve. All right. What about cutaneous sensation of the posterior thigh? Cutaneous sensation of the posterior thigh. Things going to make the most sense. Yeah, if we say S1, S2, but you're saying sciatic, right? Kind of makes sense, right? Because we have a whole compartment back there that the muscles are innervated by a single nerve. It would kind of make sense that the skin over top of that would also be innervated by the same nerve roots, at least, right? Or the same nerve complex. All right. So that's part of the reason why when we looked at the piriformis that we saw, where my sciatic nerve was, if I can get my fingers to find it. Right, there's my sciatic. Come on, there you go. There's the sciatic nerve. Then what was, what do we see? Let's get rid of that. Let's get rid of these. Right? And what do you see? Kind of just under that. Let's see. Right there. Right? So. Just deep to the sciatic nerve there, right, as it kind of comes, extends out kind of below the piriformis.
Ischium.
Right? That's the ischium, an area of the ischium, and so that bony protuberance back there is my ischial tuberosity. Right? Now this guy here, right, where let me just go ahead and draw on it. So this guy here is my ischial spine. Right? That's not the one that's, if you're sitting on your ischial spine, you're sitting really weird, right? In other words, you're like sitting almost about like Victor, right? But maybe, a little bit lower. So kind of really, lounging, right? So the butt bone that you sit on is really down here, which is what?
Your
the ischial
two tuberosities.
Okay? So, in the ischial tuberosity, when you sit, right, that means you're going to kind of do what to the thigh?
Flex it.
We're gonna kind of flex the thigh, right? So when we flex the thigh, you can imagine that all of this musculature here, the soft tissue is kind of pulled, right? And so now that's going to mean the ischial tuberosity is sitting a little bit closer, right, to that sciatic nerve. And so that's the one where you stand up after sitting in class for a couple hours, right? And the back of your legs are kind of tingly, right? Just because you've been sitting on the sciatic nerve, right? The ischial tuberosity on the sciatic nerve. Okay? And in order to stand up without falling over, you require activation of what muscles?
The glutes.
Just question. What?
The glutes, right? To
Okay,
get up.
Yeah, so, okay, so the gluteal muscles, right? If you had to pick one of them in terms, like if there was only one in a list, which one do you think it would be?
Maximus.
Moody's Maximus, right, largely, not because of the mass, but because of its more superior inferior orientation, right, to kind of help extend, right? But we require initially that gluteus medius minimus to laterally rotate and then extend the leg, right? Those are innervated by the
Sciatic. No.
gluteals are innervated by
The
gluteal nerves,
Oh, yeah, yeah,
right?
yeah.
So, which are those going to be femoral or sciatic nerves? And when I say, I'm sorry, I should say this name. Lumbar or sacral nerves, let's put it that way.
Sacral.
Those are
Lump.
like gluteal nerves.
Sacral.
Sacral.
Yeah, they're kind of both, right? So pretty much lumbosacral, right? All right, so what about cutaneous sensation to the anterior compartment of the leg?
Genius.
That's also cutaneous sensation, anterior compartment of the leg.
Femoral. No.
Right, yeah, so it's divisions off of the femoral, so we're thinking like L2, L3, right? And the only one that's kind of separated, in other words, it's kind of like the musculocutaneous of the thigh in that it has its own separate cutaneous portion, is the lateral femoral cutaneous. Right? That lateral femoral cutaneous is an L2 nerve, right? And it's not doing any muscle stuff, right? So that's one of the